Hello, everyone. I'm Patty Kaufman, the co-founder and communications director of CLL Society, and I would like to welcome you to today's webinar, Getting Maximum Benefit from Doctor Appointments. Your visit with your healthcare provider is a highly anticipated opportunity to get updated on your disease status and to share in decisions about your care. But your appointment is not open-ended, so your time will be limited. Planning and knowing in advance how to get the most out of your visit is the subject of our webinar today. Our first speaker, Becky McAlpin, will provide advice from her years as nurse practitioner about how you can put your best foot forward and increase the benefits of your doctor visit. The information you bring is critical for your healthcare providers to accurately evaluate the status of your disease and look for trends. Next, Steve Delesie, a caregiver, will show you how either you or your caregiver can assemble the most relevant facts about your CLL and medical history and prepare in advance your pressing questions for the doctor to make certain that they are clearly addressed during your visit. We'd like to thank Adaptive Biotechnologies and Bristol Myers Squibb for making this webinar possible through their grant support. At this time, I would like to introduce Dr. Brian Kaufman, Executive Vice President and Chief Medical Officer of CLL Society.
Hi, thank you, Patty. It's my pleasure to introduce today's excellent speakers. Becky McAlpin has been an advanced nurse practitioner for 14 years, serving patients at UC San Diego's Medical Center, beginning on the bone marrow transplant team, where she worked with both inpatients and outpatients. She then became the outpatient hematology nurse practitioner. Becky works with both benign and malignant hematology patients, but has a special interest in CLL. She monitors patients both on research protocols and just in standard therapies. Steve Delesie is a devoted husband and caregiver to his wife, Cindy. Cindy was diagnosed with CLL back in 2016 and is undergoing treatment now at Winship Cancer Center, Emory University. Cindy will soon be completing a course of venetoclax and obinutuzumab. In the way of background, Steve graduated from the United States Naval Academy in Annapolis and served as a surface warfare officer. After the Navy, he spent 40 years in sales and marketing in the men's apparel industry. But what we're interested here is that he's an incredibly organized caregiver, and we'll be sharing some helpful information with you all today. We will be answering audience questions at the end of the event, so please take advantage of this opportunity and ask your questions in the Q&A box throughout the presentation. Thanks for joining us today. I would like to start by welcoming Becky McAlpin. Becky, thank you.
I'd like to thank Dr. Kaufman and his wife for inviting me to share about clinic visits with you. I'm a nurse practitioner who has been at UCSD for almost 14 years. I started out on the bone marrow transplant team, inpatient, and then transitioned to the outpatient, where I worked primarily with 2 CLL physicians. In the last 3 or 4 years, I've become the nurse practitioner for the entire team, but still have a great love and interest in CLL. So, you have a clinic visit. Are you in the right place? I'm not talking about what building you're in. Are you in a place where you feel comfortable? We need to do our best to listen to our gut instincts. So with the physician you're with, do you feel like there's good two-way communications? Is he understanding what you are saying? Are you getting good feedback? Do you have a good rapport with his staff? Both with his staff and the physician, you need to understand that they're the experts and they're going to do the very best they can for you. Your job is to be transparent and open. There are questions we're going to ask that you may not want to share, but it will really be critical to how we care for you. So come prepared with your histories and be sure you're in the right place. So your visit really starts before you arrive. I have been able to network with nurse practitioners across the United States, and how we do it at UCSD very much mirrors what everybody else does. We have a pre-clinic meeting, and our case manager has your last note, your last labs, imaging, any procedures you've had, and we thoroughly discuss your case. We know if you may need to be thinking about treatment. We know if you're stable, and this is just going to be a relatively quick visit. We know everything about you up to this point. If you've shared anything, our case manager also has brought that on board. At the meeting, there is a clinical research manager, and she brings all the appropriate clinical trials along with standard of care. So we have discussed if we think you need treatment, what treatments you need, what needs to be done. If you're coming from out of state, we probably have on the day before your visit are trying to get you in for a bone marrow if you're willing to consent for it. So know that your visit has been thoroughly investigated long before you arrive. So on the day of your appointment, this, what I'm going to say right here, is kind of pre-COVID. It would be great if you would bring someone along with you, someone that you trust, someone that will listen, and someone that will help keep you on track. You and whomever you bring need to have a talk before you get there and make sure that who you bring is not going to hijack the appointment and share too much. Often significant others give us vital information, but the visit really should be between you and the physician. If you don't have somebody you can bring, consider bringing some kind of a device that you can record. Come prepared with all new information that has taken place since your last visit. One of the most important ones is your insurance changes. Hopefully you've taken care of that long before the visit. But if you bring new insurance the day of the visit, be aware that they may not pay for that visit, or maybe a treatment that you're going to have that day. And we don't want that to happen to you. So insurance issues need to be taken care of well before the visit. Bring any healthcare records from other physicians where you've been treated or have gone to. This is vital so that if there's something going on, we know about it. If you're going to integrative medicine, please let us know what's going on there and if you've had any treatments. Recently, I had a patient who I was working up for a second diagnosis, and I had ordered labs. I knew exactly what treatment I was going to give her. And at the very end of the appointment, she said, oh, by the way, I went to my integrative physician yesterday and I had an infusion of XYZ. I just thought you'd want to know. Well, not only did I want to know, but that totally changed the plan. There would have been some labs that would have been invalid, and certainly she wasn't going to get treated right away because of that. So share these things with us early on in the visit. If you have any changes with your family, medical, surgical, or social history, please let us know. It's okay just to give us the Reader's Digest version, but we certainly need to know any changes because it could affect your treatment. So this is my big thing, medicine update. I will say in our system, for any of you who come to us, I know there's a little irritant that you may correct all your medications on the registration papers that we give you, and they don't show up on your chart. We're doing the best we can. And when you're in clinic, a lot of times things are just going so quickly that the case manager can't change it. And in some systems, they don't allow the case manager to change it. And your provider may not be able to because he or she keeps moving on. If you come to see me, trust me, your medication list will be updated. Are you getting any injectables or infusions anywhere else? Have you missed any scheduled doses of your medications? Or have you actually stopped a medication because of side effects? These are very important things to share with us. If you've heard me speak before, you know that one of the saddest things I experienced when I was on inpatient was a patient had gone through transplant successfully, was still on some prophylactic medicine, and one of them didn't agree with her, so she stopped it. Came into the hospital, we couldn't figure out what was wrong. We were giving her the medication, but didn't know that she hadn't taken it for several weeks. And she really got a rip-roaring infection and actually succumbed to the infection. We do not want this to happen to you. We enjoy our long years of meeting with you. So if there are any changes in your medication or you can't take a medication, let us know absolutely as soon as possible. If you're on a clinical trial, do you need to bring back your study drug? And I know you fill out diaries and things like that on a clinical trial, but if you've missed any doses, that's very, very important information. Seems like almost everybody takes supplements these days, and that's great. If you're taking more than 4 or 5 supplements, please bring them on a list and we'll scan them into your record. A lot of times we can't add them to your medication list because they're not on our formulary. But if we have a scanned copy, we can keep abreast to those at that time. Do you have any changes in alcohol, tobacco, or stimulant depressant use? If you do, please let us know that. That could explain something that's going on or give us some clues. When I talk about stimulants or depressants, the big one is marijuana. In the state of California now, you can get it legally at many shops. Know where you're getting the marijuana and make sure it's as clean, and as pure as possible. If you're growing it in the backyard, that could be a big problem. One of the things with marijuana is often because it's grown in the ground, you can get a fungus from it. And we may have a hard time figuring out what it is, treating it. So if you're on marijuana or anything else like that, please let us know and be sure you're getting the cleanest product possible. Travel plans. Great. We hope you go on many, many trips. If you do, be sure and get insurance, because you have an altered or weakened immune system. Things could change rapidly the closer you get to your travel plans. If you're going to travel internationally, please go to the cdc.gov site, look up the country that you're going to, and see what vaccines are needed. As you know, as a CLL patient, you cannot have any live vaccines whatsoever. So if you're going to a country that requires yellow fever, that's a live vaccine. You cannot take it. If you're going to a country where you need a typhoid vaccine, you can take the injectable, but you cannot take the pill form. So know where you're going and what is required. And please never, 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 ever take a live vaccine. In our clinic, we like to have all of our patients have a Z-Pak on board in case they would start to have an upper respiratory or sinus infection. So if you don't have one, you could ask your primary care, or you could ask us for a Z-Pak to have on hand when you travel in case you would start to have upper respiratory or sinus infections. If you're going out of the country, the other thing you might want to have on board is an antibiotic that would relieve any GI problems. You can talk about that with your primary care or with your CLL physician. Go and have a great time. So we know that you come with many questions. If their questions are yes and no answers, you can just shoot them off at us. But if you have some serious things you want to talk about, please prioritize the questions. A lot of times the questions require some explanation, some education, or there's a two-way discussion with this. So limit your questions to 3. And if you bring 3, know that if we take 5 minutes for each one, that's 15 minutes, and you've eaten in through a lot of your clinic visit. Electronic records, use them to your advantage. Almost 100% of physicians' offices and universities are using them. They're a great place to look at your labs. You can graph your labs and get a lot of information. They're also a direct tool to communicate with the staff. So if you have any non-urgent questions or information you want to share, this is the best way to do it. It's almost like email. The caveat is it has to be non-urgent. Please do not send us a message saying I have a fever of 103. We may not get to it for a day, and that could be crucial to your health. So please use this appropriately, but please use it. In-person visit or virtual visit. From March 2020, we started using virtual visits almost 100% of the time. And now virtual visits are here to stay. While the pandemic is winding down and we want to see you face-to-face more often, if you are stable, if you don't have progressive symptoms and your blood counts are not moving, then a virtual visit may be appropriate. If you are having any symptoms, if you need a long discussion, please, please, please ask for an inpatient visit. A virtual visit is needs to be prepared for just like an face-to-face visit. Be prepared with all of your notes from other physicians, have somebody with you, be in a place whether you're at work or at home where there are no distractions. And if you have an animal, please have somebody else taking care of it, or the animal put someplace where they're not going to interfere with the visit. We're sure you have great animals and we like to see them, and it may be appropriate at the very end of the visit to show us your new puppy. But during the visit, it can be a great distraction, and we want you to get the best bang for your buck for the visit. So please have your animals cared for someplace else. It'd be a good thing to have a person with you, again, who can take notes, who can keep you on track. And know that when we're looking at you with the cameras, that wherever you go, we can see. I've had some very interesting visits in the last year. And the one that probably startled me the most was a patient was sitting in her chair. We were having this great history taking. She got up, she walked to the bathroom, she did her job, she flushed the toilet, she washed her hands and came back to her chair. I don't think she had any idea that I was a part of her whole visit to the bathroom. So be considered and be wise. COVID. The good news is that it's winding down, but there are still protocols in place, any place that you are going to go. Know your clinic's rules for this. At UCSD, we just received an email last week that we can have visitors at your clinic visit. So this is a place where you're not going to need to record, but you can bring that very important, significant person who's going to help you with the visit. However, you can't have a visit in the infusion center yet. You will be stopped at the door and ask all these questions. They will put a sticker on you saying where you can go and what you can do. So know what is expected before you get there so you don't have any surprises or disappointments. Ask if you need to be COVID tested before. At this time, if you're asymptomatic, you do not need to be tested in our facility. And if you've gotten the vaccination, great, thank you very much. Share your vaccination status, excuse me. And the big thing is, so many CLL patients are asking for the antibody test, and we will allow you to have it. Be aware that we don't know what to do with the information. We have some studies ongoing right now with our CLL patients. We're tracking those who has a vaccination and those who've got the antibodies. We could have two patients with the same counts and one have high titers and the other one have no titers. So don't be alarmed by the results of your test and give us a little bit of time to figure out what to do with it. Research. If you are on one of our research protocols, thank you very, very much. At our office, the biggest one is the day you're a new patient, and we ask you to sign so that we can just draw blood at intervals. We'll draw blood on the first day and then maybe 6 months later. We have found so many things. I think ZAP70 was found off one of the labs years and years ago. So this is just crucial information. Besides helping us know how to treat you correctly and looking at your mutations and labs, it is also a repository or a bank where other researchers can come and say, I need 100 people with a ZAP70 in this range or this mutation, and they can use the information that you've provided for them that will help bring CLL to a cure. Clinical trials are a little different because that's the active treatment. And if you sign up for a clinical trial, you are helping everyone. Thank you very, very much. So our visit's over. We feel like that you feel like the most important questions have been answered. You understand what to do between now and your next visit. Know when you should return. That may happen that day, or one of our administrative assistants may call you, but know that you will get a call. And I hope you feel like your visit has been a success wherever you go. We look forward to seeing you in the future, and thank you very much.
Hello, I'm Steve Delesie, and I'm the caregiver to this lady here, Cindy Delesie. We have been married for 53 years, and she has CLL. Okay, she was diagnosed in 2016, kind of by, like a lot of people, by mistake. Her primary doctor had noticed her white cell blood counts going up and said, you should get that checked out. So we didn't know where to go, what to do. So we found a local general hematologist and made an appointment. Okay, and it wasn't, to be honest with you, the best experience. I don't think he was used to dealing with people with CLL or maybe minimal patients. But basically, he didn't really look up from his computer and said, this is what you have. You have chronic lymphocytic leukemia. And of course, we went, oh my goodness, that's terrible. And, you know, kind of like somebody hit you over the head with a 2x4. So basically he said, oh, it's not as bad as it sounds. And I said, well, what do we do? And he said, you just go home and she eats more vegetables. So we walked out and looked at each other and said, you know, that's not going to work for us. That's not what we, you know, did. But we were still in a lot of anxiety and basically somewhat of a position of fear. And we kind of recalled, you know, we had a great 32nd president, Franklin Delano Roosevelt, famous for quotes. One of his quotes was, the only thing you have to fear is fear itself. And we said, wow, that makes a lot of sense. And we had two choices. We had the choice to make CLL our enemy or make CLL our friend. Okay, so nobody wants CLL, and we don't want it to be a friend, so to speak. When I say friend, I mean just learn a lot about it so you know about it. Okay, so that being said, we went and researched. We went to Google, Dr. Google, which was a huge error, actually made things worse. And somewhere along this journey, we found that there was a CLL seminar at the University of California, San Diego on a Saturday. And this is back in 2016. So we hopped in the car and went to it, and it was probably the best thing we ever did. At that seminar, we met the Orange County CLL folks, society folks, and met a lot of great people. And we said, hey, we're in. So we joined the Orange County support group. And that was on our way, and we started to learn. Okay, so what you want to do is when you're preparing for appointment, you want to formulate your what you want to ask, and you want to do that. You don't want to do it in the car on the way to the appointment. We tried that; that doesn't work. You want to do it maybe 3 days prior to your appointment. And what we do is we do it individually. Cindy will come up with her 3 best questions that she wants answered, and I'll come up with mine. Then we have a little meeting and we say, okay, we agree on these 2 and we agree on that, and let's ask this. Okay, so now what you have to do is you have to make an appointment questions form. And this is very easy, as you'll see in a moment. Include your name, date of birth, and date of the appointment. I've learned over the years that medical people seem to identify you by your name and date of birth. Okay, so write down your most top 3 questions that you want answered. And put them, if you can, and you know, obviously the first one is the most important, and then the second and the third. Include a space in case you want to handwrite some notes on the responses, and then print a copy for everybody you think is going to be present at the appointment. Usually it's 3, it's the physician, the patient, and the caregiver, but there might be somebody else, so I print up an extra copy. Okay, now one of the reasons for this is going back to advocating for your best care is to make sure that you are concise and to the point, because these CLL specialists, their plates are extremely full. They just don't have a full plate, they have many helpings. You know, if they're at a university, they're teaching in the medical school, they're running trials, they're researching, they're writing papers, and they're attending medical conventions, and they're also seeing patients. So you have that moment to be in the sun. Okay, now, if you look at this next slide, appointment questions, you see it's very simple: patient, date of birth, the date of the appointment. On this one, am I still 13Q deleted? Should I get a second flu shot? On completion of an EDICLAC, are you going to test for MRD negative? Okay, so those are three, and those questions might get answered within the appointment, but they might not. So that if they don't, you have that. Now, one thing that I've learned is don't pull that appointment questions out when you walk in the door to the appointment. That's probably not a good thing to do. It's kind of your physician's forum. They'll explain from your recent blood test what's going on and what your situation is. And usually at the end of the appointment, they'll say, do you have any questions? Okay, that's your cue. If you have questions, bring it out and say, yes, I'd like to discuss this. These three. So in some cases, they might be answered within the conversation anyways. So those are covered, but you covered three that you need to know. It's just, you just don't want to leave an appointment and say, you know, I forgot to ask this, because you might not have another appointment with that person for a month, 2 months, or 3 months, depending on what kind of schedule you're on. Okay, so that covers making appointments, a form for your questions that you want. Okay, the second form, which is also, I think, very helpful, is keeping track of your major CLL events and medical history. Here again, keep it simple, highlight it. You'll see on this example, what comes out: CLL, 13q deletion, unmutated, CLL tumor, 30 grays of radiation, hemoglobin 4.8, goes on and on and on. So your doctor knows these things. It hits them right there. You don't have to read a lot of stuff. And the reason that this is, to have this in the chronological order, is your physician might not have immediate access. They have access to your information, but they might have it right there in front of you. So you can say, particularly if you're going to another doctor that hasn't seen you before, you can say, here's the history. And it's a good, it's a good practice to keep this with you when you're traveling on vacation or wherever you might be. So that's what we have on hand. We have the appointment questions, and we have the medical history chronologically ordered to have with us in case we need it. The next slide is, I think, is the most important one of all. It's keeping track of your lab results. To me, this is the holy grail of all your personal lab history. It is like unbelievable. Okay, so where you find this is you go to cllsociety.org, and you'll find a thing called Toolbox. And if you go down, you'll see a thing that says keeping track of lab results. And here, you just click on that, and it will take you to this next screen, which is wonderful. It's got everything that anybody needs to know. It lists all the major complete blood counts information. And if you do it chronologically by date, you take the date. On the side, there's an area for notes if you should like to add a note. And what's so really cool about this thing is, for example, if you put in something like HGB, hemoglobin. I had no idea what hemoglobin was. So if you click on that question mark, is a drop-down screen, and it'll tell you that hemoglobin is responsible for getting oxygen to your organs. Very important thing. So that is something that's easy to do. When you go to your appointment, the doctor will normally give you a copy of your blood results. If they don't, please ask for it, and they will give you that. You get home, it takes 5 minutes, you just transpose it on the sheet, and you're done with it. You can keep the sheet on your laptop as the other two forms, on your iPad, or you can keep a physical copy of that. Okay, so here, to find your lab results, and why should you track this? Well, your doctor, again, might not have immediate access, and they track the trend of your treatments and your disease. I hate the word disease. I call it an uninvited guest. So that being said, they have a broad view of this whole thing by going here. And it may be useful if you need urgent care. And let me just share 3 times where we actually used the history of major CLL events and the lab tracker. Back in September of 19, Cindy had seen, it wasn't anything to do with CLL, she had seen her endocrinologist, and just a normal blood test for, it was treated for thyroid disease. And we're sitting there Friday evening, 7 o'clock, having a glass of wine, and we get a call from our doctor. She says, whatever you're doing, stop and go to the nearest emergency room. Your your hemoglobin is 4.8, it's critically low. So we had two choices. The closest hospital was Mission Hospital, where we lived in Mission Viejo, and then the other one was UCI, where she was being, where her provider was and being treated. So we rolled the dice and we went a little farther, went to UCI, but we took these three forms, particularly the two forms, the history of major events and the lab records. Well, they had access to the computer and everything going on, but they said, thank you, we got this all on one sheet. So it was of a benefit. Okay, the second time that we actually used this, and when I first started, I said, I'll probably never use this, but I want to have this there in case I need it. Well, we changed providers to City of Hope. In our first meeting at City of Hope, I call it the meet and greet, it was a little bit longer, maybe an hour. The physician said, you know, I have to apologize. I have your lab results from this morning from the test that we just did, but I don't have all the history hasn't been transferred. So I guess that would have been a kind of a waste of appointment because there wasn't a lot to talk about. And I said, well, here, I have the whole thing here. It's on one sheet. And she said, the physician, she said, well, that's wonderful. How'd you do this? I said, I didn't. I just filled in the numbers. I said, the CLL Society has this on their site and it's a wonderful tool. She said, well, thank you very much. She said, may I keep a copy? So no, this is your copy. So that was another time we used this. The third time we used this, and we wasn't planning on it, we moved a year ago from Southern California to Atlanta. And this AIHA, autoimmune hemolytic anemia, raised its ugly head again. So we ended up going to Emory, and she's now being treated by Dr. Jonathan Cohen at the Winship Center at Emory University. He said, wow, he says, and it was an emergency again, the hemoglobin was way down. He said, I don't have any records, but I said, well, here, here's the history and here's the blood counts. Well, that was good for, till they got all records transferred from the City of Hope. So it's another time that we use that. So it's a great tool, it's wonderful, and I highly recommend it. Okay, the other thing I would like to end with is the takeaways. And it's very simple. Make a list of your questions prior to your appointments. We discussed that. Keep track of all your key CLL events in medical history. Again, in bullet form, simple, clear, concise. And then utilize the CLL Society's lab tracking spreadsheet. That's a most valuable tool, I think, that we have used. It's been almost life-saving, so I highly recommend that. Anyways, that's it from me. Hopefully this will help you in your journey, and as it helped us. Thank you very much.
Hi, Dr. Brian Kaufman here. Weren't those terrific presentations, really helpful advice? And now we have Becky McAlpin and Steve Delesie are going to join us to answer some questions from the audience. So I'll move forward with some questions. We've got some that came in before and some that came in after. But Becky, I'm going to throw a couple simple ones at you. First, just some definitions. What the heck is a Z-Pak?
That is azithromycin. It is an antibiotic, and we like to give it because it covers upper respiratory, sinus. You take 2 pills the first day, 1 pill for the next 4 days, and that pretty much eradicates whatever is going on. So it's an antibiotic.
And the other term was ZAP70. Remind us what that is and why that might be important.
ZAP70 is one of the markers that we use. If you are negative, that's great. If you're positive, depending on how high it is, it helps us to know how soon you might progress and leave the weight watching or the active observation part of your disease.
Steve, I'm very interested in this issue of recording, and Becky can weigh in on this too. What would you advise someone if their doctor says, I don't allow recording in my office, which does happen. Do you have advice to that patient?
I would think that if they didn't allow recording, you can't do it. So, and then also think about this. If they do allow recording, they're going to record what is said in that appointment. It may not cover the things that would be on a question sheet. It may not cover some history. So if you can't record, I think you would be smart to have the 3 forms with you, and you could use that.
Becky, do you want to add anything?
Well, first of all, I think Steve did an amazing job, and I recommend anything he said as a patient and a caregiver you do. I've never been with a provider who would not allow you to record. Even as a provider, when I'm a patient, when I go in, it may be for something simple. I may have my questions. It's so easy to forget. I guess if you can't record, then you absolutely need to have someone with you.
And I might add, I would be a little concerned about a doctor who didn't want to be recorded, to be honest. That would give me pause. You know, what is he or she concerned about in that regard? Here's one for you, Becky, and both Steve and Becky touched on this issue, was the issue of the questions and bringing the questions in advance and not overwhelming the doctor. You don't want to walk in with 40 questions, and you want to ask your most important question first. But some people have thought it makes sense to write out the questions or type them out and hand them maybe to the nurse when she walks in the room so the doctor can be thinking about them at the beginning. But Steve was suggesting maybe waiting. Do you have advice people asked about when's the best time to do that? Because sometimes there's not a lot of time left at the end of the visit. Steve, do you want to start with that?
Yes, in our experience, I didn't want to like overwhelm anybody and come into the appointment and say, here I am, and this is what I need to know, and you know, we got to answer this right away. I looked at it as the form is the physician's forum. And in our experience, in the 3 different providers that we have used, they all at the end will have said, do you have any questions? So if your questions are concise and are limited to 3, those can pretty much be answered fairly quickly. So that's what I think I would recommend.
There's somebody had a comment here that their oncologist said no phone use during the visit. And a lot of doctors' office will say that. But I don't think that applies to the recording of the phone. I think that applies to talking on the phone. That's the way I would take that. That's what I would take that to mean. Let me ask you this, Steve, and you and Cindy have been through a long journey with CLL, and not all the news is good news. And sometimes when you get a bad piece of news, it's hard to hear anything after. You've just gotten the C word, you know, you've just been told you have cancer or the cancer is back. Do you have any advice to a patient sitting in the room who's maybe heard something that they don't want to hear, how to process what happens afterwards? Because this is a real issue for people. You know, they just sort of blank out. They're just, did he just tell me I had cancer? What's going on? And they're not hearing while the doctor is still talking.
Yeah, I think that's a tough one. And it happened to us, as I said earlier. We left kind of in shock the first appointment we had. But I think for us, it was important to learn as much about it and become familiar with our situation, because that eliminated a lot of the anxiety and fear. Because as I said earlier, the biggest fear is fear itself. So that's when we researched as much as we could to the right places like the CLL Society and attending meetings to become familiar and be with people that are basically in the same situation you are. And I think that's the tactic that I would take on that.
Steve, you mentioned that you found the local support group by attending a meeting. I remember that meeting in San Diego. But for people who maybe are, have people from all over the US, all over the world here, how do they find a support group if they're interested?
Well, there's a list on the clsociety.org site. And if you look at it, I haven't looked at it lately, but it'll say support groups, where they're located and when they're having their meetings. And that's actually a really good place to find that.
I'd like to know a little bit about what symptoms should a patient talk to you about for each visit, like if they were last seen 90 days ago or something, or even 30 days ago. How does a patient decide what symptoms they should be talking to you and the physician about?
Well, we have a list that we usually give them at the beginning of, while they're in the waiting room, that they can fill out. But the CLL is a B cell disease. So the ones that are most important are the questions: are you having night sweats? Are they drenching or non-drenching? Is it every night? Have you had a fever? Do you chill with the fever? A lot of times the patients tell us they're cold all the time. That's a little different than having the shivers. How's your energy? We used to ask how's your fatigue, but I prefer how's your energy. And if it's progressively gotten worse, or you're not sleeping, or you need to take a nap, that's very important information. And is your weight stable? Have you lost any weight? Are you able to complete your meals? Sometimes you can be very hungry and have a plate in front of you that you normally could eat, but after 3 or 4 bites, there's no more room. That's a very important thing, because that tells us if your spleen has had to come to the rescue, and it comes to the rescue actually very poorly, and it may be bigger and pushing on your stomach, and you can't have that. And then basic things you would do at any other doctor visit: cough, shortness of breath. Shortness of breath almost could be moved up on the list. Chest pain, palpitations, nausea, vomiting. We could go on and on. But the 5 most important ones are the B cell: night sweats, fevers, chills, energy, and how you're eating.
And there were some questions specifically about night sweats. Is there anything a patient can do to mitigate that? And obviously, for some women, there can be some confusion about menopausal hot flashes versus night sweats. Can you help us in terms of what a patient can do about that, and if there's a way to differentiate other causes of that?
I think almost universally in the last 14 years, if somebody is having CLL type night sweats, they're just around the neck area. I've never really had them reported anyplace else. And you're right. Sometimes women have power surges when they're in perimenopause. That's entirely different. And for the most part, we see these at night. On occasion, a handful of patients may have the sweats during the day. That would make me kind of look at something else. And what can you do about it? Tell us as soon as possible. Let us get some labs on you. They're not going to go away until you're treated.
There was a question here again for you, Becky, about a doctor not wanting to do CTs or MRIs to, this is one going to be close to your heart and close to Dr. Kipp's heart, not wanting to do CTs or MRs to follow the lymph nodes, just relying on the examination. And there's lots of accessible nodes. So can you explain a little bit about the exam that the physician does to check for nodes, and what the role of CT and MRI is in following the nodes?
It really depends on your physician. The physicians I work with are excellent at finding lymph nodes. You may be sore after the exam is over, but if you have an enlarged lymph node, they will find it. And Dr. Kipps in particular probably is better than a CAT scan or an MRI. And I think when you go on a clinical trial, they require CAT scans or MRIs. So we want to save that. We don't want you to have too much radiation. I think that's really where we're coming from. We're going to palpate wherever we can get to a lymph node. You have lymph nodes from your head to your toes. The ones we get to are in your cervical area, your axillary, your groin area, and sometimes behind your knees. I just think that if you have a doctor that doesn't palpate, then you're going to have a CT or an MRI.
And the latest guidelines suggest that, NCCN guidelines, IWCLL guidelines, these are international organizations that look at how to treat CLL, that unless there's an indication, there's a problem, a mass, a symptom, there's no reason for routine CAT scans or MRIs.
Absolutely not.
Along that line, Steve, do you have a way that you and Cindy follow your imaging studies? Because that's part of it. You know, you have a way you're following the labs, but it can be important to know that I had a lymph node and it was, you know, it used to be 8 centimeters in diameter and now it's 1 centimeter back to normal. Is there a way that you keep track of those to help with your doctor's visits?
Well, fortunately, we haven't had that problem. She basically did not experience any lymph nodes getting larger. So she didn't have any CTs to look at that because it really hasn't been an issue. So I guess we've been kind of lucky in that point.
Yeah, what I've done is just printed them out. I mean, there's not a lot of way to summarize them. And often if you're getting them the same institution, they will mark certain nodes and say, this is, a node that we're going to be following, and you can actually follow them in a good radiologist report. This, when it was done a year ago, this node was this size, now it's that size, just like you can get the graphs of your blood work. So, that doesn't happen everywhere. And if you're getting CTs or MRs at different institutions, you won't see that. But if you're going to the same institution, and the other thing I ask for is when I get imaging is that I always ask for the disc. And then when I go to see a new doctor, I bring the disc and they quickly import it. And because there's a universal language that the radiologists use and a computer language, and it gets brought in, it gets imported, and then they can compare it, because often that's going to be critical, just like knowing what your labs are. So that's another way, is to get those burnt copies. And you can get that done right after the imaging. I mean, right after the imaging, you have to wait sometimes an hour for them to burn it. But I try not to leave without that. Becky, you mentioned a moving blood count being very important, and you've talked about that, Steve. What do you mean by that? Because your patients, I'm not sure, understand what it's a significant change. Like if you go from a hemoglobin of 12.3 to 12.1, that's probably within lab error. It's not significant, but how is a patient supposed to decide what's important or not, or should they not decide, leave it to the doctor? Help us with that.
The lab that we're looking at the most critically is your absolute lymphocyte count. CLL is a lymphocyte disease. So that marker, what we do is you need treatment, or we start talking about treatment, if that has doubled in less than 6 months. So you could come in with a white count of 30 and your absolute lymphocyte count might be 28, come back in 3 months and there may be a little movement. But if you hang out there all the time, you might be, and you're not symptomatic, you may not need treatment. But you could come in with an absolute lymphocyte count of 4, and in 3 months it's 24. We have to look at that very carefully. So the ALC is the number that we look at the most. If your white count is trending up, if your hemoglobin is going down, and if your platelets are going down, the 3 cell lines, then that's an indication that you may need treatment. So 12.3 to 12.1 is nothing. 12.3 to 10, we're going to look at a little more seriously.
I think both of you touched on having other diseases going on. Comorbidities is the medical term. One of the problems is patients have is in the average age of a CLL patient is early 70s. So most of us have something else going on. What do we share with the doctors? And how do we sort out whether this is my arthritis or my CLL? This is my medicine for my blood pressure or my CLL medicine. Maybe Steve, is that something that's come up for you and Cindy in terms of your, trying to figure out what comorbidities, because you do have limited time. You can't go through everything.
Yes, exactly. She had one situation where she actually had a tumor on her thigh. And that was, in the end, it was discovered that it was a CLL tumor. Okay, it was a sarcoma. So that on our history sheet, we record that. She has asthma, that's recorded. And she has severe osteoporosis, and that's also recorded. So I think those are important things to have handy because it does explain those comorbidities.
There was some questions here about the how difficult it is for you, Steve, to transfer the labs to the and you talked a little bit about this in your slide presentation, but is that a difficult process? Do I need any medical experience to transfer? You know, I'm handed these 5 sheets of lab results as I'm walking out the door, and maybe I understand 20% of it. Is it hard for me to get that into the spreadsheet?
Not at all, because a lot of that stuff, I don't even know what it is, to be honest with you. But when they give you when your physician gives you your lab report from the meeting, the first thing I do is when I get home, I have the spreadsheet downloaded. It takes maybe 10 minutes at the most to transpose that. And what's on the lab tracking sheet is exactly the same blood counts and things that come from your appointment. It's a 5 to 10 minutes. And if you keep up on it with every appointment, it's not a hard thing to do. It's a very easy thing to do.
There's a question there about SLL and CLL. So CLL is chronic lymphocytic leukemia and SLL is small lymphocytic lymphoma. And they are essentially the same disease, just presenting in different ways. So CLL, the leukemic cells, the cancerous blood cells have spilled out into the blood, where in SLL, they're still only contained in the lymph nodes and not in the blood in any significant manner. And the way it's followed is SLL is being followed by examining the lymph nodes and seeing if they're growing or not. And some people look at them as different stages of the same disease, where the SLL will eventually spill over and become CLL when the absolute count of cancer cells gets over 5,000. There's another question, so I'm going to grab this one about live vaccines. You mentioned not getting live vaccines, and that's because there is no safety data about the live vaccines, and with our compromised immune system, we have concerns about whether it's safe or not. It's not that we know that they're not safe, we just don't know that they are safe, and they really haven't been studied. So vaccines like the yellow fever and some shots like children's shots, MMR and stuff like that, can be a problem. Steve, there's a lot of questions, and I'm just interested in how you and Cindy are handling this, about the COVID vaccine, testing after you get the vaccine, and travel. Just if you could share how you twos have made decisions along that line.
Yes, absolutely. We both have been vaccinated in February with the Moderna, and she had discussed with her CLL specialist about getting the spike protein test, and we have not done that yet. So we were in California into March, 1st of April, and we're heading to California again in July for a month. We're going to assume that probably the worst case scenario, that maybe she doesn't have the antibodies. So we're going to be thoroughly diligent about masking, about distancing, and go with that premise, that because we don't know, and I understand that there's a lot of talk between the medical profession that I don't think that they figured out if people really are have the antibodies or not. So we're going on an assumption we don't.
Becky, what are you telling people about being tested for the antibody? This is a recurrent theme, the spike protein antibody. And what are you telling people about travel who have CLL?
Exactly what Steve said. We have a lot of information. We just don't know what to do with it. And we just need time to sort things out. So I think a mask is always appropriate for immune compromised patient. The social distancing, staying away from large groups. I think you just have to, those are things that perhaps you've done all along, minus the mask, but you always have to be careful where you are, who you're with. I've always told CLL patients to have a mask with them when they get on an airplane. You don't know who you're going to be sitting by and who's going to be coughing. So I think just the universal precautions for CLL patients are pretty much the same with the COVID.
Yeah, I advise patients that you should, the CDC has put out guidelines for what to do if you're vaccinated and what to do if you're not vaccinated. And we're advising patients to pretty much assume that you're in that unvaccinated category, whether you're vaccinated or not. That may change, and we'll see. And there's a lot of active research going on, both here and in Europe, in terms of what these levels mean. But you can check your spike proteins, but just because they're low doesn't mean you're not protected, and just because they're high doesn't mean you are protected, though there probably is some truth to that. Here's one for both of you in terms of, and I'm trying to focus on the visit aspects of this. Here's one for you. With my chart and these electronic medical records, all the labs are there. What is, why bother printing them out or doing the spreadsheet if you can just go online and look at them? Steve, do you have any thoughts on that? If, you can just get them, just type them in and there you are. Yeah.
Well, yeah, yes, I do. My opinion is that if you change providers, you change hospitals that might not have the same program to run that. And in my experience, sometimes, yes, they can bring that up in your appointment, but it's laborious. They go to this screen, that screen. And to me, it's just so easy to have one sheet in front of you with possibly 10 years or 5 years, whatever it is, of those numbers right in front of you, showing all the trends and what's going on. I just think it's a good insurance policy.
Yeah. A question about vitamins or supplements. Are there anything, like if you're taking a 1-a-day vitamin, or you're taking iron because you're a menstruating female or something, is that something that I need to tell you if it's just kind of routine over-the-counter stuff that I'm taking?
Absolutely. you can't overshare when it comes to that. All
right. And there's a lot of questions on vaccine efficacy, and that's a real hot issue. And I think, I'd love to get Becky's take on this. I'm going to put mine out there. I think the thing that we can say about vaccine efficacy is your protection is not going to be predictable. It's going to vary from patient to patient, and what treatment you've had and where you're at the treatment and what your blood levels are. So you can't count on it on being protected. But there's a ton of research trying to solve this. And I would suspect it's really hard to ask you, but try to be patient, because I'm hoping over the next 90 days or so, some of these answers will read out and we'll have a better sense of not just the antibodies, but the T cells and other things that might be important. Any inside stuff you can give us, Becky, in terms of the research that you and Dr. Kipps and Dr. Choi are involved in terms of this going on?
Dr. Choi is doing great work in this. And I think, let's talk about the flu vaccine. We don't do titers on that to see where you are. And the flu vaccine doesn't always cover all the flus. I have no immune problems. I got my flu vaccine and got a terrible case of the flu 2 years ago. So it's kind of a two-pronged thing. We don't know what's being covered, and that's true actually with the COVID also. We're learning things as we go along. We've had one patient who had COVID, didn't get the vaccine, was kind of waiting, and 6 months later got it a second time. That was news to us. And that's only one patient that I know of within our practice. So give us some time, but please, please get the vaccine.
I just want to say to Steve's point here, we got a question from Ireland, And as I think some people know, there's been a cyber attack and their health system records have been down. And the patient is saying, thank goodness I've kept track of my records myself, because I'm helping the doctor because they can't access some of these records. So another reason to have this on your own hard disk rather than relying on the system. We're a little over an hour into this, so I'm going to ask both Steve and Becky if they have any final comments or any final tips or anything that they want to share, and then I'll get a chance to thank them very much. Yeah, Steve, you want to go first?
Yes, I think out of this whole thing, and we discussed the charts and taking those to your appointments and maybe taking them when you're traveling, but I just think one of the most important things in all this is to be educated. And because, you know, one of your mission statements on CLL Society is smart patients get smart care. Well, to become a smart patient, I think you have to ask smart questions. And to ask smart questions, you have to become familiar with your situation. And I think that would be my most important takeaway, is to educate yourself and be involved so you know what's coming down the pike.
I would echo that 100%. Becky, anything you want to add to that?
Not really. I think he hit the most important things. The nice thing about CLL is that there is good information out there online. And if people stumble onto your CLL Society, they've stumbled onto a great tool. And then the other thing is hang on to the fact that this is a chronic disease. We don't expect to lose anybody with CLL. We're pretty sure that in your old age, it could be a comorbidity that you succumb to. So we intend to have a very long relationship with you. That said, trust your doctor.
You know, I would just echo a couple things there that, you know, one doctor advised me to kind of look at it kind of as a project, a chore, a nuisance, having CLL, you know, but it's you know, you've heard the euphemism, and I'm going to tell you, it's not 100% true, but it's getting more and more true that you're more likely to die with the CLL than from the CLL. Now, there are complications to the CLL, and Steve talked about Cindy having some, and people get second cancers and infection risks that Becky outlined. So you've got to be serious about it because it's a cancer of your immune system. But the CLL itself, likely killing you directly? No. Leading to an infection that could do you in? Absolutely. Leading to not paying attention and getting a skin cancer check? Absolutely. But I think that reality is that, you know, it's very unlikely the CLL is going to be a direct cause of death these days. So, you know, it's important that you take care of yourself otherwise. And it is something that gives you time. It's not there. It's rare that you walk into the doctor on Tuesday and he says, we're starting treatment on Thursday. I'm not going to say that never happens, but it's called chronic for a reason. So we almost always have time to become more expert. And there's, you know, wonderful resources that are available. CLLsociety.org is there to help you, and LLS and LRF and other people have wonderful resources that can help you with this. I'm so grateful to have these speakers. I'd like to thank Adaptive Biotech and Bristol Myers Squibb for making this possible through their grant support. And you're going to see a post-event survey. It's really critical that you fill that out for us. We so much appreciate that. And it helps us, and we do listen, and it's made a big difference in terms of what we're going to do down the line. So please take your time and fill that out. We have a real treat for you next month. Many people know Dr. Susan LeClaire. She's a presence in a lot of the forums and stuff, and is an absolute maven, an absolute expert in explaining in fun and easy to understand ways what your blood tests mean, how to interpret them. And I think playing off of what Steve and Becky talked about today, I think it's going to be a great session on how to decode your blood work. And I would ask you again, the CLL Society has helped you on your journey. Please consider helping the CLL Society on its journey by contributing and supporting our work in helping CLL patients and the CLL community. And we're working hard with people like Dr. Choi and Dr. Kipps and others in terms of this COVID. I was just on the phone this morning with Blood Cancer UK, and we're looking to coordinate efforts in the United Kingdom where they have certain advantages and we have certain advantages of how can we look at this issue, because it is an issue of our response to the antibodies. Or there's going to be a role for booster shots, is there going to be a role for monoclonal antibodies? You cannot believe what's going on in the background, how much activity there is. We're not forgetting about this. We're digging hard and there will be answers. So I ask you to be patient. I'm with you there. I'm trying to be patient too, to figure this out. But in the meantime, just play it safe and act as if you're not vaccinated. So thanks everyone for their attention. Please fill out the survey. See you in a month again with Dr. LeClaire. Becky and Steve, this was fabulous. Thank you so much for your preparation and your helpful responses. Thanks, everyone.
Bye-bye.
Very welcome.
Bye-bye now.
Bye-bye.